Uh, I'm Randy Martin. I'm the chair of the Stark County Safety Council. Welcome. I'm also the safety director for the Beaver Companies here in Canton. We want to welcome you to our first webinar meeting that we've had this year, and it's something new, and we'll discuss it a little more later. Please bear with us for technology, I can't even speak right? Technology issues and or maybe being able to talk correctly. But we're new to this, so bear with us and we'll get through it. But we're going to get right into our main speakers because they have a lot going on, as you're probably going to hear. We have an answer questions coming out. We have questions that have already been asked. We are not going to be able to answer all the questions yet today. So you can possibly, reach out to the health department afterwards for some of these questions, or we can send you a link later through the chambers where you could get your questions answered. But I'm just going to go straight to our main guests because they're very busy and their time is greatly appreciated to be here with us today. So I'd like to bring up Kirk Norris, Health Commissioner, Stark County Health Department. Director of Nursing is Sherry Smith, and Director of Environmental Health is Paul Depasquale. So I appreciate you guys taking time. You guys have been extremely busy. You have a lot of information for Stark County. We're still not in the red zone as far as here in Ohio. Thank you guys for all you're doing to try to help us. And I'm going to turn it over to you, Kirk, and let you roll, buddy.
Okay. Well, first of all, I'd like to say hello, good morning. Thank you for having us on today to address the Safety Council. We do greatly appreciate it. It's a way that we can get our message out as well as try to answer any and all questions. Well, in this situation, as many questions as we can get to. Like we said earlier, Sherry Smith, my Director of Nursing, is on, the county's Director of Nursing, as well as Paul Depasquale, who's the county's Director of Environmental Health. Many of you have probably spoke to either Paul or Sherry or myself in the past. So just thank you for the invite. And without much more to say, we'll get right into this so we can get to as many questions as possible. And then I think Paul's going to finish up with something that was brought up during our earlier discussion before we started the webinar. But okay, so our first question here is, have you had anyone test positive for both influenza A and COVID-19? Is there any data on Tamiflu given for influenza A and its effect on COVID-19? Sherry, can you take that one for us, please?
Yes, of course. In the early stages of this pandemic, we did have some rapid flus, both influenza A and influenza B, test positive. And then we also had some come back on the respiratory viral panel as well. And they had both COVID-19 and influenza. As the influenza season died down, if you will, and we found out more information about this virus, we did stop requiring the respiratory viral panel and the rapid flu. We're just doing COVID testing as testing came more available for COVID. And yes, Tamiflu is being used in conjunction with other medications in some of the clinical trials that are going on in regards to COVID-19.
Okay, thank you, Sherry.
Welcome.
So our next question is, are protective partitions required on bar tops to separate the bartender from the customer? Paul, can you please answer this question for the group?
Good morning, everyone. Where we're going in this area would be the Dine Safe Ohio orders or that guidance. The short answer is no. There is no mandated requirement for a barrier partition, I should say, between the bartender and the customer. However, the bartender in the guidance has to wear a facial covering, which is basically barrier protection, what we're getting at. You can use a barrier, nothing along with the face mask if you want to keep your employee, if they require more additional safety, whether it be you as the business want to require more safety for both ends, the customer and the bartender. Nothing precludes you from going further than just the facial covering. But I also, if you do that, I recommend that you speak with your fire inspector in your area to make sure that you use a material that isn't flammable and that they go over that situation with you. prior to using any type of barrier. I also want to add just one other thing, Kirk. A lot of our guidance is on the Restart Stark website. So if you go to starkhealth.org, that's our general website for the health department, starkhealth.org. At the top of our webpage is a bar that says Restart Stark on it. It's a blue bar, you can't miss it. If you click on that bar, that is the webpage that we developed with the help of Alan Harold's group to communicate coronavirus response, guidance, and up-to-date data. Everything should be on that website. We do sift through the many federal, state, and local things associated with COVID-19, and we try to break it down and put up the best available information and guidance for businesses, the general public. Schools now are quite a big issue. So that website there is where is the go-to website for Stark County and restarting Stark County.
All right, thanks, Paul. Okay, so one of the questions that we're getting a lot, and by a lot I mean daily, is do we anticipate any business closures in the near future in Stark County? So that speaks directly to the health of the county, right? So as many of you know, the governor and the Ohio Department of Health have launched the public health advisory system. So the color coding levels. So you have yellow, orange, red, and purple, level 1, 2, 3, and 4. And with those levels, there's criterion that has to be met to move you throughout the levels, be it up or be it down, and they're called key indicators. And once you spike a key indicator, your level may change or it may not change. So as of right now, we are asking for more guidance from the Ohio Department of Health because we know right now as much as you all know if you've been looking at our website or listening to the media regarding the public health advisory system. But what we have been doing is we've been proactive here at the health department and we put together a public health advisory team. Okay, so that team consists of representatives. I'm not going to name all the individuals, but the representatives from each of these offices. The county commissioners, of course, the 4 health commissioners with the 4 health jurisdictions within Stark County, a mayor from each of the 6 cities within Stark County, a member of the Educational Service Center, a member of the prosecutor's office, the president of the Stark County Township Association, of course, our EPIs that are working here at our departments. We have hospital representation from both hospitals, all 3 hospitals. We have a representative from the sheriff's office, and we also have our PIO teams, our public information officers. So this is what we're thinking this group, until we get further clarification from the Ohio Department of Health and the governor's group, what we're thinking this group is going to do is there's not much timing between moving from yellow, orange to red. In fact, just to be honest and upfront with you, we get a call at 11 a.m. on Wednesday mornings that we are told that we are going to either be staying the same or we're going to be moving levels at the 2 o'clock governor's press conference. So as you can imagine, that 11 to 2 window that we have, 11 a.m. to 2 p.m. window, is not a lot of time for us to convene this group and have discussions. Now, where this group will come in very heavily is if we ever, which we hope we don't, if we ever move from red, which we are not, we are currently at orange, if we would ever move from red to purple, we've been told that we will have a week's notice, somewhere in a week's time frame for that movement up the level. Then we will have time to convene this group, have discussions, reach out to members of more than likely your council as well as the economic development boards and some of the chambers, and get some input so that we can then have some input into the movement from red to purple. Because as you know, purple is basically, and I can read it to you, severe exposure and spread, only leave home for supplies and services, and follow all other level indicators. So that's where we're at right now with as far as any kind of business closures. specifically, it's going to be detailed upon the whole movement up the levels. So unless at some point in time, the Ohio Department of Health issues additional orders that they've already issued, as you know, is the first stay home, stay safe order, stay home order. That's unfortunately out of our control. But that's how we're looking at this whole public health advisory system. So let's move on here. Okay, so the next question is, currently we do not have a COVID-19 case in our workplace. However, if an employee reports to us that he has COVID-19, he or she has COVID-19, what is the Stark County Health Department current recommendations in regard to the status of our other employees that work with the positive employee? Sherry, you want to handle that one?
Sure. So if there's a case identified in your workplace, the responsibility for the case investigation lies with the local health department where that case resides. So if your employee resides in Stark County, they'll be working with the Stark County Communicable Disease Unit. If they reside somewhere else, they'll be working with whatever local health department where they live. And then how that works is our department, or whatever department where they live, works with them, does a case investigation, and does contact tracing. And if there is only one employee at your workplace identified as a case, through our case investigation, we discuss things like cleaning, disinfecting, social distancing, face coverings, and we also ask them to identify any close contacts that they had. Those close contacts that we ask them about include household members, workplace members, anybody in the public, any place they might have been. And when we have one case that's either probable or confirmed, what that does is it allows us to do a thorough investigation with them, but it also, we rely on them giving us that information. Sometimes we don't always get the information because a lot of times some people don't want to tell us who they've been around, and they don't have to. Unfortunately, the only thing they have to tell us is that, yes, they are staying home, they're staying isolated, and we have to make sure that they do so because they're infectious. More than one case in a workplace or in a facility ends up being an outbreak, and then that's when we do a more thorough investigation at a workplace or a facility. And again, if the workplace is doing everything they're supposed to be doing with the cleaning, the disinfecting, the social distancing, the face covering, we may not even have to do an investigation at the workplace because the case who's infected might not have any close contacts at the workplace.
All right. Thank you, Sherry.
You're welcome.
Okay, so the next question we have is, should we continue to keep taking employee temperatures? So I'm guessing it's at the work environment. So Paul, you want to jump on this one for us, please?
Yeah. So the answer is yes. We would like you to continue to take temperatures. We'd also like you to combine that with a COVID symptom assessment. And the most recent CDC symptoms are listed on the, there's a list, but there's shortness of breath, trouble breathing, and then two or more of, and Sherry, you might want to help me out with that continued list.
Well, it's almost every symptom you can imagine now. So it goes into diarrhea, it goes into fatigue, it goes into headache, cough, shortness of breath, fever, I'm trying to think what else, runny nose, congestion. So it's almost any symptom out there. So that's why it's important that we combine the symptom screens along with the temperature checks, because as this virus transforms and we're learning more and more about this virus, and as we're seeing younger individuals come down with infection, we are not seeing as many fevers, especially in the initial stages of infection. We're seeing more symptoms that look like the common cold or a sinus infection, or maybe some people are having like diarrhea, nausea, and vomiting, and they think it's either food poisoning or the 24-hour stomach flu. So it's very important that you're also doing a symptom screen along with a temperature check. And all those are available on the CDC website. And it seems like they've added a symptom every day. So it's a whole slew of symptoms.
So I'll add also that, again, back on our website, we do have it linked into the CDC site. So if the CDC updates the symptoms for COVID-19, our site is updated because it's linked right to the CDC. So if you go there and take a look, the best available information is there. The best, most up-to-date symptoms are on there.
All right. Okay, our next question is, what venues are we seeing for the spread of COVID-19? Okay, so I just this morning at 7 o'clock got off a call with the governor's office. With the governor's office and the director of the Ohio Department of Health and all other 112 health commissioners within the state. And we're seeing very similar venues. So as everybody knows, at least in Stark County, our numbers are increasing a little bit. They're increasing. And what we're seeing is there's 4 or 5 things that are contributing to our increase in numbers, okay? And one of the big ones is travel, all right? We've had individuals come home, large families, some school trips that aren't school related. They may be senior trips. I have to be careful when I say school trips. They're not a school function at all. So there's senior trips and there's family trips with large families that come back. And unfortunately, we do have an outbreak within the family or within the group that travel together. So we are seeing travel, especially vacations, causing an uptick. Our bars and nightclubs are also a big one that are contributing to the uptick. And on the call this morning, it was shared that the governor has asked that the Ohio Investigation Unit, it's a member of the State Highway Patrol, for those of you that aren't familiar with the Ohio Investigation Unit, they have been going out for the last 2 weeks to try to combat these bars and nightclubs that are open and aren't practicing social distancing, and basically, aren't doing anything to help with the spread, to decrease the spread and control the spread. So the bars and nightclubs are a big one as well. And then what we're also seeing is on private residences. So, there's no mass gathering order right now for private property. So any one of us can have a graduation party or a picnic, and, we can go well over the number of 10, which is on public property and in the public area, is considered a mass gathering. So what we're seeing there is quite a few outbreaks within those parties at private residences. We're also seeing, and I hate to say it this way, we're also seeing outbreaks at weddings and funerals. People are in different venues. There's different things going on. There's a lot of hugging. There's a lot of dancing. There's, sometimes, especially at a funeral, you're hugging to comfort people. And unfortunately, we're seeing outbreaks in those weddings and those funeral venues as well. So, but those are our main areas that we're seeing our uptick in within the county. And it's right in line with the rest of the counties and the cities within the state of Ohio. Okay. All right. So here's a very important one, and we wanted to make sure we hit this one. So where is testing available in Stark County? Are all locations by doctor's prescription only, and what is the cost? Sherry, would you like to take that one?
Yes. So there is testing available almost all over Stark County right now. No, there is not a doctor's order required for all of them, especially if you go to like CVS or Rite Aid. You can go online to Rite Aid and CVS and actually register and fill out an online form and schedule to be tested. However, the key is we only recommend that people get tested if they're symptomatic. Because there's so many variables in if you get tested when you're not symptomatic, it could be a false negative because the virus just hasn't shed and shown up yet in the testing. So we really encourage everybody not to get tested unless you're sick and unless you've been evaluated by a healthcare provider. So if you have a healthcare provider, call your healthcare provider. They can tell you where you need to go for testing and evaluate your symptoms and make sure that you even need to be tested. And then if you don't have a healthcare provider, you can call the Stark County Health Department or wherever you live, your local health department, and ask to speak with communicable disease. At our health department, you could just dial the nursing number, which is 330-493-9928, and follow the prompts for communicable disease, and you'll get redirected to a communicable disease line. And then we can help you find where is closest to you and where you can get tested if you're symptomatic. We also work with employers. If one of your employees have come to you and said, we're symptomatic, and you've sent them home, we'll also assist you to help them get tested if needed as well. So yeah, there's plenty of places. Most all the FQHCs in Stark County are doing it. I know my community health center is doing it, which is over by Altman Hospital. The Life Cares are doing it, and there's several in Canton, and then there's also one in Massillon, and then there's the Alliance Family Health Center in Alliance, and most of the hospitals are doing it on an outpatient basis with a physician's order.
Sherry, can you also, with that, hit a little bit on turnaround time that we've been seeing with the testing results?
Yes. So the testing results and the turnaround varies depending on where you get the test done at and what the lab is as far as processing and how close it is in proximity. Some of our labs are out-of-state labs. Some are in-state. The quickest turnaround we're seeing right now is about 48 hours for somebody that's doing it on an outpatient basis. And usually how that works is, just to let everybody know, if you're sent by a private provider with a doctor's order for outpatient testing, that physician is notified first on the results, which is usually 48 hours later. And then it comes to the health department. So sometimes we're seeing 48, 72 hours before we are aware of a positive case, if we weren't notified during like the suspect or probable phase of the infection by a physician. And then there's also some labs, unfortunately, where there's a little bit longer lag in the result time. The longest we're seeing right now is 4 to 5 days. But most of them has been about 48 hours turnaround in the last month or so for us, the majority.
And then Sherry, I hate to put you on the spot again, but there's a lot of questions regarding contact tracing and whether people have to answer your questions. Do employers have to answer the health department questions? Where it falls in HIPAA, especially with the schools? Can you just hit on that? Because I know we're running out of time here, so that's a good one to possibly end on.
Sure. So you've asked a lot of questions in that little bit of one question there. But so what I will say is an individual's protected health information is what's protected. So when we get a case that is infected with COVID-19 or any other infectious disease for that matter, what we do is we contact the case and do a case investigation. When we do contact tracing for COVID-19 and other diseases, because we've done contact tracing for many, many years. We've done it for measles, we've done it for TB, we do it for a lot of things. So it's not new to us really. And how we do contact tracing is we call the contacts and we tell them, you've been exposed to someone with COVID-19. We don't tell them who they've been exposed to. Everybody's system is a little different in local public health, but our system is we give the case a case ID number. And then that case ID number follows the case. And when we reach out to the contacts, we say, please reference case number 810, for example. So that is our 810th case here in our Stark County Health Department jurisdiction. And we're the only ones that know that. So we give that unique number to anybody that is affiliated with that case so that we can do follow-up and answer questions and know whenever a quarantine is let up or an isolation is let up or anything like that. When we have to do a infectious disease outbreak investigation, that HIPAA is sort of goes by the wayside as long as we're trying to mitigate and basically stop the spread of an infection. So HIPAA, the only really way that it goes into effect is that we don't tell the individual's name unless we have to. Sometimes if we have an outbreak, and like I said, an outbreak is more than one case at a facility, or if the individual says, yes, I've already notified my employer, it's okay that you talk with that employer, and there were several close contacts that were identified at that workplace, then we will work with that workplace to determine whether A, they can stay open, and that's a decision on them based on the amount of close contacts that they have to an infected case, or B, do they need to go, if it's a restaurant, let's just say, for example, do they need to go back to a carry-out and a drive-through situation right now because they don't have enough staff that have been exposed to continue, working at the restaurant right now. So we work that out with everybody that we talk to on a case-by-case basis, basically.
Okay. I don't know, Randy, it looks like it's about 10:29. People can visit us on www.starkhealth.org. There's a Restart Stark banner also up there on our website that Paul discussed as far as Restart Stark. And there is just a lot of information within our website and on the Restart Stark website. There's also, if you get on our website, we put out a COVID-19 epi report twice a week on Tuesdays and Fridays. If you click on this, there's an A through Z bar on our website. If you click on C, it'll take you almost right to the COVID-19 epi report. And you guys can get up-to-date numbers, deaths, unfortunately, deaths for all 4 health jurisdictions within the county. So I hope this is what you were expecting from us. We're always here for our phone number, our main office number is 330-493-9904. You can ask for any one of the 3 of us, and we can try to answer as many questions as we can for you. So we appreciate the opportunity, and we greatly appreciate you guys.
Yeah, I appreciate you guys taking the time. You got questions. I got one question that I see on our questions and answers, and folks that are visiting and listening here, they have a allotted time that they could only give us a day. But should people quarantine until a COVID test results come back? So basically, I feel like I have symptomatic problems, right? And Kirk, I just spent lunch with you somewhere, but you don't show anything. Should you quarantine until my results come back?
Well, you know what? Sherry knows that like the back of her hand.
I know she does, Sherry.
So do I, but I think you want to hear that from a medical professional. So Sherry, you want to go ahead and answer that one too?
Okay, so Randy, let's say that you're symptomatic and you got tested. Yes, anybody that's going for any testing or has any symptoms or thinks that they might have COVID-19, they definitely need to self-isolate until they get their test results back. We don't want anybody who's went for a test to be going to work. And believe me, we have that situation, but we do not want that situation. Now, you gave the example of spending time with Kirk.
Right.
Did you spend time with Kirk while you were symptomatic?
Yes.
Or 2 days prior to being symptomatic?
I did both.
You did both.
Yeah,
Well, shame on you. But anyways, if you did both, then yes, Kirk then should self-quarantine, because quarantine is for individuals who are in close contact with somebody who is probable or confirmed COVID and is symptomatic during the infectious stage. So yes, sick people should isolate themselves. And by isolate, I mean even from other people in their household if they're able. People who are close contacts should quarantine themselves. So Kirk should be quarantining if you called him up and say, hey, yeah, I know we went to lunch yesterday. We were closer than 6 feet. You know, we obviously weren't wearing masks because we were eating and drinking or whatever.
Right.
So Kirk should then, you know, self-quarantine unless he's in a critical infrastructure environment, which Kirk is. So since Kirk is in a critical infrastructure workplace or environment, in that case, he just needs to wear his mask all the time, even when he's in his private office. I see he doesn't have it on right now, but he didn't know of this exposure prior to this call. But he should have his mask on at all times, and he also should have his temperature monitored and be screened for symptoms regularly.
Okay, good answer. I appreciate that.
Okay.
Now, we're going to continue on with our webinar here for the Safety Council, and you guys are welcome to stay on. And if you guys hit the questions and answers that have came to us during this, maybe Sherry, you could answer a few of them, because I think a lot of them are towards you, but that's up to you. If you feel like it, you can type back in. But I appreciate you guys. I know you're busy, you're over inundated with everything that's going on. I think that's some great information, and hopefully our people of Stark County can take that and try to help us not become red, right? We don't want to be red.
Yeah, exactly. And you make a good point. Just one last closing thing to keep us out of the red. All right. We just need you to wear masks when necessary. All right. We need a minimum of 6 feet of social distancing. We need everybody to wash their hands. And if you can't wash your hands, sanitize with hand sanitizer. Please practice proper respiratory etiquette and stay home if you are sick, and we will stay out of the red. Okay. Right. So appreciate you guys. Thank you very much.
Appreciate it. Thank you guys.
Thank you.
So we'll continue on here, and thank you guys for doing that and being here today. And I'm sure we'll be in touch, and you're probably going to have a lot of people want to call you and talk to you now. But right now, I would like to go to Robin with an update from Ohio BWC for us today. Robin, and thank you for joining us as well, and appreciate you being here.
Thanks, Randy. Good morning, everyone. I'm Robin Watson. I'm your BWC Safety Council rep and safety consultant. I hope you're all doing well and staying safe and healthy, and I sure do miss all of you. I miss seeing everyone. We've not yet been released to go back into the field for the foreseeable future, but as soon as I hear anything, I'll let you guys know. In the meantime, if you need me, you can contact me at 330-904-4867, 330-904-4867. I'd really appreciate it if you guys could drop me a line sometime and let me know how you're doing. That would really make my day. That'd be great. Industry Specific Safety Program, ISSP. For the public sector, the deadline for completing the program is December 31st, 2020. Please complete your activity credits by taking BWC online courses. 3 hours of online courses equals 1 activity credit. If you need any help with this, please let me know. For the private sector, the deadline for completing the program is June 30th, 2021. Again, please complete your activities by taking the BWC online courses. 3 hours of online courses equals 1 activity credit. And if you folks need any assistance, please let me know. I'll help you out through that. Unfortunately, the BWC in-person classes have been canceled through September of 2020. And as I hear more information, I'll let everyone know what that looks like. The Safety Council semi-annual reports, as you should know, or maybe you don't know, but they're not due this July, okay? So typically they were due July 15th. Right now they're not due for July of 2020. Again, as I hear more information, I'll share that with you guys. The BWC premium due date for June, July, and August has been extended to September 1st of 2020. BWC has been hosting some safety educational webinars, and there's one coming up. It's on developing a driver safety program, and it's scheduled for July 28th of 2020 from 11 a.m. to 2 p.m. Safety councils will be sending out flyers for you folks to register. There'll be an icon on the flyer to register for those if you're interested. This year, OSHA's Safe and Sound campaign is scheduled for August 10th through the 16th of 2020. Sound safety practices such as management leadership, worker participation, and finding and fixing hazards are now more critical than ever. As companies continue to restart work during the ongoing pandemic, having a strong workplace safety and health program in place can help employers and workers address job site hazards. For more information on this, you can go to the OSHA website, osha.gov/safe and sound, spell out the word and then there's another /. Also this year, OSHA is having their National Safety Stand Down to prevent falls. It was rescheduled from May of this year to September 14th to the 18th. This annual stand down campaign to prevent falls serves as an opportunity to pause and refocus on falls, one of the leading causes of deaths in the industries. This year, OSHA encourages employers and workers to participate virtually or with social distancing measures. For more information on that, also go to the OSHA website, osha.gov. Work zone safety and distracted driving. I've not been out a whole lot driving because of everything that's going on, but when I have been out, I notice there are still a lot of work zones out there. So please pay attention when you're going through those areas, slow down, adjust your speed accordingly. Those workers have families too. Heat stress, we've had some really hot days. I think we're going to have some more coming up in the future. So 3 key words: water, rest, and shade. Water, rest, and shade. Know the signs of heat stress, stay hydrated, and keep an eye on your employees. Give more frequent breaks if you need to. If any of your employees are feeling nauseous, please continue to check on them. They might be in the first stages of heat stress. I think it was a year or so ago, maybe a couple years now, but somebody was feeling nauseous. They went around the side of the building to take a break. And when they went to finally check on that person, I think he had passed away from heat stress. So please be diligent and take care of your folks. And don't forget to wear your sunblock. One big pet peeve of mine, riding lawnmowers, zero turns, tractors pulling brush hogs, regular riding mowers with steering wheels, walk behinds, any type of a mower, but specifically the riding ones. Please don't let your precious children or grandchildren or any child take a ride on a riding lawnmower when you're mowing the grass. And please make sure that the little ones are far away from wherever you are mowing, so any debris or anything that flies out from under the mower doesn't hit them. So off-the-job safety is just as important as on-the-job safety, so please share any of this information with your family, friends, and neighbors. And please be responsible about your social distancing and wearing a mask. Thanks a lot, guys. Stay safe and stay healthy. Thank you.
Appreciate it, Robin. Thank you for your words of wisdom there. And, I'll conclude with one thing. We normally have a safety brief to start all these meetings. And COVID is big, right? I mean, whether you believe it or not, or whether it's happened, it's real. I know people that now are sick. I know people that passed away in other states from it. No one real close to me, but I know people. Couple things to remember. If you have a conversation with somebody and you're in that 10 to 15 foot radius, and you talk for you're in the 6 foot radius, you talk for more than 10 to 15 minutes, there's enough respiratory transfer that could be shared that if one of you have the virus, you can share with the other. What most people don't realize is a cough. A cough comes out of your mouth at 50 miles an hour. So now one cough can share a virus. There's enough in that cough that comes out that you could infect the other person immediately. A sneeze comes out of your mouth at 200 miles an hour. That can infect the whole room with enough virus to get numerous people sick. So as you're traveling, you're going around, make sure you're covering. I'm hoping when this is all over, the common cold and the flu season, we're going to be really slow at it because people are washing their hands and covering their coughs and sneezes and wearing their masks. So that's my quick brief for the day. The other thing I want to share is we will be doing these webinars throughout the end of the year until things changes and going forward. We're going to try to keep them extremely informative, something that we need to know now so that you guys still participate and get on and get some information to teach your employees and your family. So if there's anything we can do to help, please feel free to share out to the Safety Council. and get with us, get with Robin, get with myself, send something to the Safety Council. We'll try to get your answers. If there's something you would like to see us do, we do have an agenda to do, but you know, right now everything's different, everything's changed. Appreciate you taking this much time today and look forward to seeing us again soon. Because of the webinars we're doing now, we might have other counties people joining in with ours because some other counties don't have the resources to do what we're doing here today. So want to thank everybody, appreciate it, and everybody have a great day. Stay safe out there and do your part, stay apart, social distance. Okay, thank you, have a great day.